Welcome. In this video, we'll walk through key coding steps for radiology X-ray services covering CPT codes, imaging views, charts, ICD-10 tips, and common pitfalls to avoid. Let's get started. Let's review the CPT codes used to report this service. 722220, radiologic examination, sacrum, and coccyx, a minimum of 2 views X-ray showing 2 or more views of the base of the spine, sacrum, and tailbone, coccyx. These views are used to evaluate the sacrum and coccyx adjacent structures. The number and type of views directly affect CPT code selection. Sacrum AP or PA view, coccyx AP, view sacrum and coccyx lateral view, and caudal or cephalic angled view. Radiology report, order exam, sacrum coccyx 2 views, header, AP, angled AP, and lateral views of the sacrum and coccyx. History, injury, fell and landed on the tailbone, now with pain in the coccyx area. Comparison, none available. Findings, there is a minimally displaced transverse fracture through the inferior sacrum. Mild degenerative changes of SI joints. Impression, minimally displaced inferior sacral fracture. Let's look at the views, AP, angled AP, and lateral views. That's a total of 3 views. This qualifies for CPT code 72220, radiologic examination, sacrum and coccyx, a minimum of 2 views. Now, let's choose the appropriate diagnosis code based on the clinical history and chart findings. The patient has a history of injury, specifically a fall onto the tailbone, and is now experiencing coccyx pain. Findings: there is a minimally displaced transverse fracture through the inferior sacrum. There are also mild degenerative changes of the sacroiliac joints. The most appropriate ICD-10 CM code is S32.19XA, other fracture of sacrum, initial encounter for closed fracture. This ICD-10 code is designed for fractures of the sacrum with specific location described but not matching zone or type criteria. Clear, generalized documentation, such as inferior sacrum, qualify for this code instead of using the unspecified code. The correct codes for this report are 722220, radiologic examination, sacrum, and coccyx, a minimum of 2 views, S32.19XA, other fracture of sacrum, initial encounter for closed fracture. Thanks for watching. Be sure to check the links in the description for helpful resources and subscribe for more radiology coding content.